and we will make sure that hopefully we will finish on time by the end of this morning. I mean, so we will not be taking any time from your lunch and prayer break. So this presentation is about Tele-ICU project at King Faisal Specialist Hospital. We're supposed to have Dr. Fahad Al-Araifi. For urgent reason, he is not able to join us. And then Dr. Muhammad Jamil, he is the director of the Tele-ICU, and he is also a consultant critical care pulmonologist and sleep medicine at King Faisal Specialist Hospital. So I would like to welcome you, Dr. Muhammad.
No, this is not mine. Did you put the USB? Yeah. The first one, no, second one. Assalamu alaikum, bismillah ar-Rahim. It's a great pleasure to be here this morning. I'm just gonna go for a few minutes talking about our project and also end up summarize with a videotape about this project. This project started in 2008, where we did brought the idea to the eHealth, where they have a great program at King Faisal Hospital, and we started looking how we're going to help the regional hospital. And when I brought the idea, I have some experience when I was in the United States in a Virginia hospital, and one of the Virginia hospitals called Innova Fairfax Hospital. So the concept started with one hospital over there and continued to grow to cover now almost 25 hospitals in the region for Ministry of Health. Initially, we have minimal participation around in 2008, around a few cases, and now we grow up to have more and more cases and more hospitals to participate in this program. The cases, the consultant was initially hesitant to start this program, as most of the eHealth that we mentioned in the previous lecture, but becoming more involved in this system and covering more cases and more information with education. So we came up with a platform that was homemade, and I'll show you some slide about this platform to help the consultant in the regional hospital or over Kingdom of Saudi Arabia to be able to communicate with us on the same language. Same thing as computer, you have to have the same language for all the database to be able to communicate with other. So we thought we needed to do the same thing from the physician perspective. So we brought this system, and you can see we put all the database there for the patient, so we have a continuous medical record for those patients down the road. And then we put the past medical history and what's the current problem. Now, then we start putting the history to be available for all consultants in at King Faisal Hospital and also in the regional hospital. So we put all the physiological parameters to be able to be seen by everybody, and at the same time we have a platform and the database for Apache score, so we be able to get data down the road and to measure our success or our failure and to be able to improve it. So all the data was put here based on the Apache score for Tele-ICU that we use it as benchmark to be able to see are we working on the right direction or not. So after we discuss the case, and sometime we can be able to see the patient and see the ventilator setting and all the data, all the medication, all the x-ray, we'll be able to create more information for the consultant at the other side of the camera, and he'll be able to adjust his management based on the discussion. And we can put all kind of central line, antibiotics, sedation, all those basic stuff that we need as an intensivist to be able to give the best care for our patient. So we put all the data down in the form, and this is all will be reflected at the end result and end report of the patient. So even the x-ray and the radiology, since some hospitals they don't have the digitalized system, we're able to put it as a download system, which is totally secure by the IT team in our hospital. So we put them and we put the report and will be clear there. Then we assign different consultant based on the hospital, and they can adjust it and can be seen by the hospital in the region, like in Hafuf or Qasim, any place. And each hospital, they have their own signature. So nobody from regional hospital, they will be able to access different medical record that doesn't belong to their patient. So there is total patient security based on that. And the report will be followed, and we'll create this platform that can be put in the chart and in very systematic ways that nobody can mix and have error. Always a human error is available, but when we put the data and can be reviewed by 2 or 3 person, and you get the final recommendation that the physician at the bedside, he can utilize. We did not stop there. We start creating a program of education, because if we did not educate them, and this means reprogram those physicians at the bedside to have the same language that we utilize it internationally. So we created in the same system a guideline page, and we put a calendar for the whole year for the education from nursing, from physician, and amended also all the guidelines from the different society internationally, so anybody can be able to access it. And those are accessible to any person have an access to the system. As I mentioned, report will be automatically generated, and we put. At the end of the day, we'll be able to put all the data and statistic in a push of a button based on the information that we enter. So you don't have to create a new job. It's already there, so you can see every physician, how many consultation he did, every physician, what data he put, how much it took him time to put those information, so nobody will say, oh, it's taking too long. So this will be very clear based on statistic and database. And we start doing a conference over there. We just finished a non-invasive conference in Oneza. We're able to bring also those information in addition to Tele-ICU to be able to collect it together and make the clear cut for the physician how to practice. This is a system that the room that we're utilizing for different area, and this is the Tele-ICU system. And I'm gonna end up with a small video. I'll let you to enjoy it. Do we have volume?
Medical achievements in today's world went beyond all borders. With the utilization of new technology that King Faisal Specialist Hospital and Research Center provides, our healthcare team is able to observe and assist patients at all regions in the kingdom. One of the leading services provided by Health Outreach Department is the eHealth Center, which was recognized by the World Health Organization as a collaborating center on eHealth. Tele-ICUs help improve the outcomes and quality of care and reduce waiting time and bed utilization at King Faisal Specialist Hospital and Research Center. It also improves services at remote hospitals. Moreover, it provides lectures and training for medical staff in the different regions. Furthermore, the service of health outreach for international and national medical second opinion made an impact on patients' convenience by minimizing traveling abroad to get treatment they need and receive medical second opinion at a reasonable time.
We are proud that the eHealth Center at King Faisal Specialist Hospital is one of the 3 centers in the world recognized by WHO. This recognition came after a continuous effort and support from our management. back to the history, it was 1996 when we established the first telemedicine between King Faisal Specialist Hospital in Riyadh and hospital and university in the United States. From that experience, we learned a lot, and we established our national telemedicine. At that time, we were utilizing the satellite, and subsequently the technology advanced, and we are utilizing fiber optic. With this technology, it gives us more reliable, more stable, and with this great infrastructure, we were able to launch e-health application and services that benefit patient, physician, nurses, and health alike. With all this success, it was an excellent partnership between Ministry of Health as well as King Faisal. I am sure that if we continue to have the same momentum of this collaboration and partnership, we are going to launch more successful story and more advancement in a form of e-health, m-health, and the rest of advancement in technology.
Good morning, Dr. Vivek. I heard you have an interesting case that we need to get some opinion, and also the family requests second opinion.
Right, yes, we actually discussed this case last Wednesday with Dr. Hosseini. We just want to catch a follow-up on this patient again.
So we can actually ask one of the respiratory therapists to join us now.
Respiratory care services are an integral part of the Tele-ICU team. Many regional hospitals don't have respiratory care services. The Tele-ICU brings a diverse range of expertise and knowledge to patients all over the kingdom. Every day, we discuss patients that are critical, receiving mechanical ventilation, non-invasive ventilation, and other respiratory care modalities. We give our recommendations, knowledge, and we give demonstration to healthcare providers about modalities that they could do to their patients. This way, we ensure quality and safe patient care, both internal to this hospital and to patients who are all over the kingdom.
This program is providing us with a communication tool between King Faisal Specialist Hospital consultants and the intensivists from the referring hospitals throughout Saudi Arabia.
We have relationships with world-leading institutions such as Johns Hopkins, Mayo Clinic, Cleveland Clinic, and Memorial Sloan Kettering Cancer Center in New York. The medical second opinions are paper-based or live face-to-face video conferences or an audio conference between physicians. Occasionally, family members will attend. The International Medical Second Opinion program utilizes lean principles in resource utilization. For every rial that is spent doing a medical second opinion, we're saving over 50 rials versus sending the patient abroad.
We are introducing a new clinical service through telemedicine consults for arrhythmias. We hope that this will be of great benefit to our patients because they currently come from all over the kingdom traveling great distances. We expect to be able to help our peripheral hospitals in managing complex patients who are critically ill and cannot travel and have arrhythmias. We also hope to provide consult services while patients are still in their hometown.
We have so far about 22 Tele-ICU services where the King Faisal people provide, or King Faisal specialized doctor in the ICU provide their medical services to the patients in their hospitals, in the regional hospitals. This service, which is Tele-ICU, we are very proud of it. It started in 2008 with 2 centers. And alhamdulillah, so far we have 22 centers connected with the King Faisal Hospital in Riyadh, where the hospital will provide them with tele-ICU services. The patient stay in their hospital, and our staff here communicate by video conferences and provide them with the care they need. And this service really has very good impact on the patient, where their satisfaction were very high by avoiding traveling to Riyadh. Also, we have the Health Outreach Department. It has offices in 22 hospitals all over the kingdom. These offices provide lab requests, provide medication for the patients, and provide also educational sessions where the staff in King Faisal might give an educational sessions to their colleagues in the regional hospitals through communication by telemedicine or by video conferences. So in conclusion, we are very proud with the outreach services in the hospital. We hope that in the future it will expand, and I hope this will be helpful to our patient and avoid them coming to Riyadh or even traveling abroad.
Thank you very much, and I would like to thank the eHealth and the Health Outreach Program in our hospital, and Dr. Padar Raifi, Ali Mishari, and Mazen Kirallah, who programmed the Tele-ICU system, and hopefully we can improve down the road. Thank you very much.